How do I get out of a Medicare Advantage plan? I find this really curious. Medicare gives you actually a number of ways to leave your Advantage plan, but if they're so great, why does Medicare give you options to leave them, but you can only leave them under certain situations? So, you can't just drop them at any time. We're going to talk about this, and this is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Okay. One of the curious questions is, and a lot of people do searches on the internet, is how do I get out of a Medicare Advantage plan? It's kind of like they have their private Benjamin moment. Well, this isn't the Army I joined. I joined the Army with the yachts and the condos and so forth. Well, this is the same thing that can happen if you have a Medicare Advantage plan. You say, well, this isn't exactly what I thought it was. How do I leave this sucker? There's different ways to do it. Some are more difficult than others, but there's always a catch. There's always a catch. And we'll talk about that in just a second. Okay, the way that most people will leave a Medicare Advantage plan is during the annual open enrollment period. It's October 15th to December the 7th. They'll say, okay, I've had enough of this thing. I'm leaving. I want to go back to original Medicare. Well, you can do that, but you may not be able to qualify for a Medicare supplement plan. So before you jump ship, make sure that you've got a place to land on the other side. You can go from Medicare Advantage to original Medicare, and it's not a problem. There are no health questions. You can have pre-existing conditions. You can have all kinds of things going on. And you can go to original Medicare. But joining a Medicare supplement plan after leaving an Advantage plan, it's not exactly the easiest thing in the world to do. So make sure that you've got a place to land before you bail out of that. But you can leave during the open enrollment. You can also say, well, I kind of like these Medicare Advantage plans. I just don't like the particular one I've got. I mean, it really stinks. Okay, well, you can change to another Medicare Advantage plan if you want to. But just I want to check it out a little bit. If you were enamored with the one that you've had and then now you decide it's not so great after all, well, just make sure that you check out the plan that you want to jump to, that your doctors are in network, that your medications are covered, what your out-of-pocket is, and all these different rules that are out there about Medicare Advantage plans. There's a couple of other ways to leave your Medicare Advantage plan. Like the Paul Simon song, 50 ways to leave your lover. Well, there's not exactly 50 ways to leave a Medicare Advantage plan, but there are a different number of ways, and open enrollment is one of them. There's also a Medicare Advantage enrollment period. I think they've changed that name a few times, and I think that's what they're calling it now for 2021. And it's basically January, February, and March of each year. You can leave a Medicare Advantage plan, and there's not a whole lot of rules to it, but you can leave a Medicare Advantage plan and go to, you can either go to another Medicare Advantage plan, you can go to original Medicare, and if you go to original Medicare, you would probably want to pick up a supplement plan. But again, make sure that you qualify for that supplement plan before you decide to bail on what you've got. But like I said, it's really interesting that Medicare gives you several different ways to get out of a Medicare Advantage plan. And again, if they're so great, why does Medicare say, well, we're going to give you a chance to, take a mulligan on this sucker and leave it? So you can leave a Medicare Advantage plan. It's not there's rules. I mean, these are Medicare rules, okay? So it's not just I can leave at any time. When I get tired of paying for all these claims and everything, I want to get over to that Medicare supplement plan where my out-of-pocket is almost nothing and I can use any doctor, any hospital, anywhere I want. Well, again, it may not be possible for you to get into a Medicare supplement plan. So if you've got questions about this, give me a call. I'll be glad to answer them for you. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.